Hello, everyone, and welcome to Ask the Pediatrician Live Monday. Good evening, good morning, good afternoon, whichever part of the world you're watching from. Welcome to Atp Live Monday. I am Misola Boyde. I'm a pediatrician, and for the next 1 hour, my job is to answer any questions that you may have about the health of your children. So feel free to drop your questions and we will try and answer them in the next 1 hour. Welcome. This program is brought to you by Ask the Pediatricians Foundation. And on Ask the Pediatrician Foundation, our mission is to ensure that no child should die from things that are preventable. And so that is what we do through our programs online and offline as well. So thank you so much for joining us this evening. So if you have any question about health of your children, feel free to start to drop them in the comment section. For those watching on Instagram, for those watching on Facebook page and Facebook group, Ask the Pediatricians, and for those watching on YouTube. If you're watching on any of our other groups, you have to click on the video so that you can get to the comment section and I'll be able to see your question. So thank you for everyone. Good morning from Alberta, that's Canada. Thank you so much for joining us all the way from Canada's Lulu. All right, so it's good that I greeted everybody in all the possible time of the day that you may be. So I'm just going to quickly share the video to all the various platforms. So you can also share, invite your friends, invite your family members, invite anyone that you know have a child and they will want to maybe have a question for a pediatrician to answer them. So invite them to join us, and the good news is that they can get the answer to the questions live and direct. Of course, if you have any question after the live section, you can always post your questions to us on Ask the Pediatrician Facebook group. It's a group you cannot miss when you get on Facebook. We have one of the largest parents support group on Facebook. So what is remarkable or unique about our group is whatever answer you get from us, you can be sure that is the pediatrician's perspective, evidence-based. So it's not just anybody giving you an answer. You are getting answers from professionals. So we are happy for you to join us. All right, so I think I've shared the videos now and I'm happy to start to take questions. I just want to be sure they are pinned and then we're good to go. But start to drop the questions, Instagram, Facebook, start to drop your questions now and I will be able to answer them. So you're welcome. And just to remind us that our projects, our Ask the Pediatrician First Aid project is starting this month. And I want to encourage you to support us. I want to say thank you to those who have supported us already. Nothing is too small. Even your 1,000 naira will help us to print at least 10 booklets that we're going to share to our secondary school students and teach them about first aid. And our online course is also almost ready, and we're also going to share that, and it's going to be available free. So we really will appreciate your donation in cash and in kind. So thank you so much for joining us. Okay, I think I'm good to go. All right, so welcome everyone. For those who are just joining, I'm Misola Boyde. I'm a pediatrician, CEO Ask the Pediatricians Foundation, and I'm here to answer your questions that you may have about any of issues. So I will start as usual from my Instagram audience, then I'll come to Facebook. Just checking to make sure I don't jump somebody's questions. So I'm happy somebody's joining us from Canada. Okay, Loop Say good evening, ma. My daughter is 15 months and I did exclusive breastfeeding. Well done. I introduced her to some brand from 6 months, but I wasn't putting milk because she never took it with milk. Now she eats. All right. So still we don't okay, she eats some food, but the problem is she has started having bow leg. But should I worry? Okay, so bow leg can be normal, what we call physiological. In other words, there's nothing wrong. As children get older, the leg will straighten out, and those types tend to run in some families. So most time we don't do anything about it. But if it is really very significant, it could also be a sign of something like rickets, or other diseases. So it may be good for you to just have a doctor have a look, so they can have a look depending on how cuffed the legs are. They may want to do some basic blood tests, calcium level, and all that, and maybe some x-rays just to rule out rickets. Once they rule out there's no rickets, then they will just watch it. But if it is significant or there are evidence of rickets, they can treat that as well. So that is what you need to do. Um, you should just give your child food naturally. Most bow legs, if the child is not having rickets, it has nothing to do with giving extra calcium and all that. As long as your baby is breastfeeding and taking milk, most of the time the child will get all the calcium they need from the milk. So I don't really say, I would definitely not tell you to go and buy any calcium supplements and give to the child unless a doctor is prescribing it, because they have side effects, and one of them is constipation. And then when you're giving calcium, there are some other things you should not give together. So we don't recommend parents just using calcium on their own. It has to be prescribed by a doctor, because they have to give the right quantity. They have to give you more information on how to use it and all that to avoid the side effects. So, but the most important thing is first is to make sure whether is a physiological one that doesn't require any treatment, or whether it's something like rickets is going on, which will require treatment. But there are other signs of rickets. There may be thickening of the wrist. There may be some the bone along the chest wall, the anterior chest wall may be very prominent, what we call rickety rosary. So there are many things that we will see as well. The child also have other signs. So it's not just the bow legs alone that we will see for us to worry about rickets. So that's what I will recommend. All right, let's go on to more global properties. Good. My son is 4 months old. He's on exclusive breastfeeding. His poop is greenish. Is the poop normal? Usually we don't expect babies to have greenish stools. For babies on breast milk, the stool usually should be like soft yellow color. And so greenish stool sometimes, especially if it is small and scanty or like watery, it tends to suggest what we call starvation, like the baby is not getting enough of the breast milk. So, or sometimes it could be from pigments, maybe something you have eaten that can stain the baby's tooth green, and it's passed from your breast milk to the baby. So those are the two possibilities. But the most important thing first is make sure you are breastfeeding your baby very well. When you are breastfeeding exclusively, you need to make sure you empty the breast. There are two parts of breast milk. We have the beginning part, the fore milk, and the end part, the hind milk. And the fore milk is tends to be watery, and the hind milk, the last part, tends to be fatty and creamy. And so we want your baby to take both part. But sometimes some mothers just quickly breastfeed and you don't breastfeed long enough, and so your baby does get only the watery part and not the fatty part. And those kind of baby, it will be as if you're starving them as well, and then you can have those kind of greenish stools. So make sure when you breastfeed your baby, the baby empties the breast before you switch over to the second. And you must always make sure you alternate your breast as well, and breastfeed as often as possible. We say on demand. Anytime the baby wants the breast, you give, and at least nothing more than 3 hours in between feeds. So that's about how much they can take, and then you just keep breastfeeding. So, and then maybe pay attention to what you are eating yourself, especially if you're taking drugs or taking anything flavor, anything that may also affect the baby's too. So those are what you can pay attention to. But as long as baby is gaining weight, there's no other problem. The color of the stool is not really a problem per se. It is what information it is giving to us that really matters. Okay, let's just take one of more question from Instagram, then we'll go to Facebook. Good evening from Yeti Love. My fourth baby is 14 months old, but she has refused to take solid. Okay, apart from her cereal. So this is if for a 14 months old baby, I mean, this is not um when you expect them to be struggling with solid. Most of the time, we have left it for too long. That means that when you started complementary feeding at 6 months, you were doing mostly cereals. You were not really giving the baby all those other food. And that is why sometimes some babies are so used to taking the cereals. And sometimes, actually, if you're giving it through the bottles as well, then they don't want to take other food. So it's very important that when we start complementary feeding, we do it right from the beginning. Never but to feed your baby complementary feeds. All the food must be through the cup and through the spoon or plates, never through the bottle. Even when you're giving them cereal, it has to be thick cereals, not something that's going to go through the bottles. And then we don't wait until they are 1 year old before we start giving them other food. Right from that time, they are 6 months old, you start with everything. So you must always make sure you start giving them things. And even now, you still can give the child. You start with initially porridge like things, then mashed food like mashed rice, mashed potato, and then of course you graduate to full solids. That is how you do it. You have to do it. You have to persist. There's nothing like you give something and the child doesn't want to take it, and then you say, okay, no, that means the child doesn't want to take it. No, you keep offering it. It may just even be one little thing the child will take the first time. That's okay. Then the next day you try and increase it to maybe 2 or 3 bolus or something, and that is how you persist on it. And we usually say that you must have offered something at least 1 3 times, that is 13 times, before you can fold your hand and say the child doesn't want to take this. For example, if you want to give all those swallows, you can use your draw soup like okra soup, ogbono, ewedu, those kind of soup. Most babies will take soft amala, soft semo with those ewedu, and you put your crayfish and all those things inside. Very well balanced meal for a child to take, and most children actually loves it. So you must experiment with all these things. You must try. You must, and it's not something you just want to do when you're in a hurry. And you really, meal times, you have to be patient and you have to be persistent, and then you keep on doing it. And don't worry about the quantity at the beginning. Just focus on letting the child at least take them, and after that, the child will begin to take them. It's not going to come easily to them, but we must be persistent and not always take the easy way out. So I hope that is helpful yet to love. All right, let's move on to Facebook because I see the questions are rolling a lot. Good evening, good morning. I know some people are watching from different parts of the world. Okay, the first person on Facebook say, good evening, ma. My baby of 5 months has not been able to turn from front to back. Okay. Must he roll to the sense having a fall before you say baby is rolling? No, your baby doesn't have to roll like a football. The baby doesn't have to roll. It's just turning from one position to the other. So if you put the baby on the back, then you find them on the tummy. That is all the rolling that we're talking about. Or if you put them on the tummy and you find them on the back. And usually it's like we said, 5 to 6 months. So since your baby is just 5 months, it's not something I'm going to worry about. I will only worry about it maybe after 5 6 7 months, because that is, we expect baby to achieve it by 6 months. So sometimes some babies are a little bit slower and we just give them some time to catch up, but it is not something to start panicking or to start worried about. The most important thing for a 5 month old to have is a neck control. I definitely want to make sure your baby has neck control. If your 5 month old already has neck control, can sit with some support, that is okay. You don't need to worry about. And when we say rolling, we're not talking about baby rolling continuously. We're just talking about baby changing from one posture, what we say supine to prone or prone to supine. That is all the rolling that we meant. So, and that is enough. It doesn't have to be ongoing rolling. All right. Okay, let's move on to the next question. Another one from a Facebook user. What can I use to clean dark spots or mosquito bites on my 1 year, 8 months old baby's life? Nothing really. Just leave it. Most of the time, the skin will always change. We're always shedding old skin and having new skin, and some of these things will clear with time. We don't recommend using any product, any chemicals, just to change spots and all that. Most of the time will clear by themselves. Use your normal Vaseline, use your Oreo shea butter, your olive oil, your coconut oil. Those natural things will be fine, and with time it will clear. All right. Somebody say, good evening, Ma. Say, it's been a long time I joined your live session due to work schedule. Yes. Thank you for joining us today. I must say you are doing a great job. Thank you so much. Unfortunately, I can't see your name, but thank you so much for your kind words. Uh, Somebody said an answer from ATPNs is authentic and professional. Wow. Thank you so much for your kind words as well. Okay. Somebody says sparkly skinned milk good for a toddler 3-year-old. Yeah, toddlers can take skim milk, but it's best they take full cream milk because at that age we want them to get all the fats. So it's not like we're trying, I know most of us take skim milk and all that because we don't want to take too much of the fats and all that. But for children, they need it, they can take everything full cream, but it's also okay if they take the what's it called, the skim milk as well. Okay, somebody said we're based in Canada, and I noticed a lot of the black moms here get vitamin D supplement for their kids. Is it necessary? It depends. Different countries have different uh regulations. So I know, like in the UK, for example, they also give vitamin D supplement because they don't have as much sunlight. So the risk of vitamin D deficiency is a real thing in those places. So for the it's common for them to get vitamin D supplement for the, especially for the babies who are still breastfeeding, because we know that there's no way they're going to get the vitamin D. But for children who are eating and going out in the sun, there are other sources of vitamin D as well. But if you are not sure, then it is okay, and you may want to ask your GP or your, I don't know how old your child is, your officer, whoever is in charge there, what they recommend for in that place. In Nigeria, we don't recommend vitamin D supplements routinely because we have abundance of sunlight, and so vitamin D deficiency is not much of an issue for us. And there's some of this food that we eat, some of them are fortified with vitamins, including your butters, and some of those things they always add. Even all these multivitamins most are always taking, most of them have vitamin D and stuff in them. So, but we don't routinely recommend supplementation. But I'll just say follow whatever is the recommendation where you are living. All right. Adoroja Funmi, good evening. I have a baby of 1 year, 9 months. He's not talking yet. He called daddy, but not clear. He has not called mommy, but he responds to instruction. Do I need to be worried? Um, for a 21 month old, definitely we want a 21 month old to be talking more. Definitely saying more than one word. So if you're almost 3 years old is saying only one word, I will be worried, and I will want you to see a speech therapist. I'm not saying there's a problem, but we don't lose anything seeing a speech therapist to have a look at the child, give you some advice on how to promote your child's language development. And as a parent, sometimes you may not pay attention to certain things that will worry a professional. So for example, we parents worry about your child talking, but there are several milestones that come before the talking. So there are other milestones that we're looking out for. We're looking for how the child plays. Is the child interested in toys? Is the child trying to do some pretend play? Because language is actually pretend, so you pretend that the word dog means dog. So if you don't have the ability to do pretend imagination, then you won't be able to speak. So speech therapists and developmental pediatricians, we are looking for those uh, pre-verbal skills. So we're looking whether your child is giving high contact, whether they're responding to their name, their receptive speech, and then we're looking for the imagination and all those stuff. So if we are not seeing that, then we worry more. But if we're already seeing that and it's just the expression or the expressive speech that is remaining, then we know the child is on track. So that is why it's important to see a speech therapist. We're also going to be looking out for whether there are other red flags for possible autism, for example, any repetitive behavior, any unusual behavior. So we'll be looking for all those things, which sometimes parents don't even take note of at all, but a professional will be able to have a look. So sometimes there's nothing wrong. The child is just a little bit slower, and then they catch up, and there's no problem. That's fine. But if there are other problems, we want to pick it up on time so that we can start what we call early intervention. So I would just recommend have a speech therapist look at your child and let them advise you what next to do. But like I say, it's nothing to worry about, but we just want you to have a look. All right. All right. I don't think they see any more question on Instagram, so I'll continue with Facebook. So Instagram, if you have question, please drop your question, and we will answer them quickly. All right. Somebody said, "Good evening. Can hydropper be used for a 4-month-old baby with pink eye?" What do you mean by high dropper? Do you mean an eye drop? I really want to be sure. Sometimes people use words that make meaning to them, but maybe I'm not familiar with it. So if you can clarify what you mean by high dropper, I would like to know. But if you meant eye drop, which is usually antibiotics, which have to be prescribed by a doctor, the answer is yes. So, because I saw somebody asking the other day on our Facebook group that, oh, because a child is a baby or it's a newborn baby, oh, that you cannot, no, it's not even a newborn baby. I think it was a 2-year-old baby, that you should not put eye drop for babies, that you should go and use breast milk. Please, that information is absolutely wrong, okay? We can give eye drops to baby. In fact, indeed, we used to do that when babies are born. We usually put eye drops for all babies when they are born to prevent them from having infection, because sometimes some of the mothers, the baby coming through the birth canal, lots of germs, lots of bacteria in that area, it can get into the baby's eyes and it can have infection. So routinely we actually put some eye drops at birth for babies. So there's nothing wrong with putting eye drops for baby, but we have to, a doctor has to be the one prescribing it. Don't just walk into any pharmacy and buy any eye drop and put on your baby's eyes. Please don't. If you think your baby has red eyes, maybe it's a conjunctivitis, an infection, you have to see one of my colleagues. Let them prescribe the appropriate eye drop, and then you drop it in the eyes. And one thing I need to say is that when you're putting eye drops in baby's eyes, number one, you must do the 2 eyes. It doesn't matter whether it's only one eye that is affected, you must do the 2. Number 2, don't touch the eye drop plastic, the tip of it. Don't touch it to the eyes. You must drop it a little bit away from the eyes, because once you touch it onto the plastic or the dropper, you have contaminated it. And that is why most times the children don't get better, because you have actually introduced the infection into the eye drop that's supposed to be treating them better. So those are important things for us to remember when it comes to using eye drop. All right, I think I have one question on Instagram, or 2 actually. So let's take them. Ada Ume, I've got an 11-month-old twins, and I blend everything I give to them. You don't have to blend everything you give to them. 11 months old, why? So when we start feeding our babies, we start with porridge, okay? That's around 6 months. By the time the children are about 8 to 9 months, you should move to something a little bit coarse, in something with the texture should be less smooth. So that's the point. And that is when you start doing the mashed, mashing things, mash your rice, mash your potato, mash your yam, and have things in there. Give them soft swallows, semo, hamala, all those ones. Then you go before you go into the full solid, like they can take a small cube of yam and hold it in their hand, eat their banana holding it in their hand. Everything should not be blended all the time. No. Of course, there are some things that we know when you want to cook it, you have to blend, but it's not everything that has to be blended. You don't have to blend yam, you don't have to blend your potato, you don't have to blend your rice. So you should be moving your children from very smooth to a little bit of coarse texture and then to full solid. That is the way to go. If not, then you're going to have the problem of the first person who asked question about their child refusing solid after 1 year because they're never used to it. You must make deliberate effort to introduce children. I know some children have difficulty with swallowing solids and all that. Those ones may need professional help, but we have to make sure we introduce our children to all these things and gradually. And usually by 8 to 9 months, we want them to start taking match food. We don't want them to be taking blended purees all the time. And by the time they're about 1 year old, we want them to be eating like the adults, like the entire family, whatever you are eating, they should be able to. So if you need more information on complementary feeding, I always advocate go to our Facebook group. We have a whole section, we call it guides, and we have one on complementary feeding, or you can download the Birth and Beyond app online. It is free, and those videos of complementary feeding, they are there. What do you give your children from 6 to 1 year? What do you give your children from 1 year to 2 years? The quantity, the texture, all those information, the frequency, they are all there. So you may want to check those ones out for more information. All right. The Oni, good evening. Please, what causes tonsillitis? Tonsillitis is an infection of the organ called the tonsils. So tonsils is one of those structure around the airway down in the throat area. So it can get bigger in some children and it can get infected. And when it gets infected, you start seeing like pus coming out of it. And that is most of the time it's bacterial infection. And usually it requires antibiotics. And if some children are having it several times, sometimes we just have to go take away the tonsils. If it's so big, it's causing obstruction or it's causing recurrent infection. If a child is having like 6 of it in a year, because usually when children have tonsillitis, they have very bad fever, sore throat, very uncomfortable, very bad smell, what we call halitosis, the mouth odor and all that. Sometimes we treat it with antibiotics, but if we have to be treating it again and again, sometimes the best option is to go and take it out completely. It's not really like an essential organ. It's one of the, what we call lymphoid tissue, is one of those organs that protect the body, produce antibodies and stuff like that. But if it's giving more problem, we can actually take it out because we have other organs that do the same thing within the body. So that's what you need to do to avoid it. Toluwa Lonyope. Hello, Mama. My baby was born premature, 36 weeks. Okay. Feeding change at 8 weeks. She's currently 4 months and weighs 4.8. So your baby is 4 months, means your baby is actually 3 months because your baby was born at 36 weeks. Birth weight was 2.5 kilos. Okay. How do I encourage her to feed well? Your baby should be on exclusive breastfeeding. There's really nothing that should be changing. Your baby should be on breast milk only. Your baby should suck directly from the breast, because even though your baby was preterm, your baby was a what we call a near-term baby. Just 1 week, your baby would have been a full-term baby, and your baby was born at a normal birth weight. So for a 2.5 kilo baby, no concerns. Put that baby to the breast. Let the baby suck directly from the breast on demand and frequently. So make sure your baby is well attached to the breast, sucking well. Let your baby have other complications during delivery or any issues which a pediatrician should see the baby for and be managing. Otherwise, there's no reason why your baby should not be sucking directly from the breast and sucking on demand and only breast milk. No water, no formula, nothing else, just give breast milk only. The weight is not so bad. 4.8 from 2.5 is not bad. It's almost doubling, so which is quite good. Just breastfeed and baby should be fine. And if you're having difficulty with that, then you need to see us so that we can provide some support around that. Okay, let's go on. So many people were given hydroxychloroquine at the hospital. Well, if you have seen a doctor and they're giving you a treatment, I will not give a 4-month-old baby loratadine. I will never give that. Loratadine is meant to be given from age of 2 years. So sometimes doctors who see babies are not pediatricians, so sometimes they are not very conversant and they treat our babies like small adults, so they use the same treatment they would have given to adults and they use this lower dose for the children. So what I normally encourage our parents to do, please, before you give any medication to your child, read the leaflets. Read the medication leaflets. Loratadine, we don't give to children below 2 years old. So I don't want your baby 4 months old to be given loratadine. I don't know what eye drop they were giving to you. Most of the eye drops, children can take them as well. That's not the problem, but definitely non-loratadine. There are alternative anti-allergy medication that we can give to babies if we worry about that, but loratadine will not be the number one on our list. So, yeah, and if you really want a second opinion, the best person to say is the ophthalmologist if you are worried about allergic conjunctivitis. I'm not sure why the loratadine is being given to the baby, so but we give loratadine for allergic conditions. So if the doctor is giving you that, I'm thinking the doctor is suspecting allergic conjunctivitis. However, there are eye drops that are for allergic conjunctivitis, so which the ophthalmologist can prescribe for the baby. The baby doesn't need to take it by mouth. We'll put it in the eyes as well. So it's not clear to me what other eye drop we were given, but please don't give 4-month-old loratadine. It's not age appropriate. All right, so Adroja for me say, good evening. I have 1 month old baby that has umbilical granuloma. Okay, I hope you know what it is. That got busted. Actually, umbilical granuloma should not bust because umbilical granuloma is actually a healing tissue. It's not like a boil or a cyst. So I'm always very wary when parents use medical jargons. Okay, so I would rather for me that you post a picture of this granuloma on the Facebook group and let us be the one to tell you whether it's an umbilical granuloma, because by definition I would not expect a granuloma to burst. It's a tissue, it's a healing tissue that is excessive and it's just going to dry up and that's it. So if you are not too sure what it is, just post a picture of it for us and let us give you an advice on it. But usually if it is a granuloma, which is an excessive healing tissue, there's really nothing to do. The most important thing is just keep cleaning with methylated spirit, or sometimes you can use salt water and just apply it with the gauze on it. The whole essence is that we don't want it to get infected. We want it to dry up. And in some hospitals, we can actually cut it off. We have what we call silver nitrates. We can actually burn it off. We call it cauterization. We just burn it off and that's it. So those are the three things we normally do for umbilical granuloma, but it should not be busting. So I'm not quite clear whether what you're calling a granuloma is actually a granuloma, but it's okay. But that's what you really need to do about it. All right. Okay, so somebody said, what age should a child start school? Okay, that question is a little bit loaded question because if you ask, we pediatricians, we divide children into different age group. So we have the newborn babies, which are 0 to 28 days. We have what we call the infants, that is 1 month to 12 months old. We call them infants. We have toddlers. Toddlers are the 1 year to 3 years old. Then we've got preschoolers. Okay, so pediatricians call the 3 to 5 years old, we actually call them preschoolers. So that already tells you that our school age children is 6 to 12. 6 to 12, then we have our teenagers, 13 to 18. That is the spectrum of all the children that we see in pediatrics. So strictly speaking, to the pediatrician, school starts at 6 years old. When your child starts primary 1 or year 1, basic 1, whatever you call it. But if you are referring to play groups, nursery, kindergarten, they are all preschools as far as we are concerned. So even though you will call them schools, but anything before the primary school age is preschool. But you can take your children to play groups, kindergarten, nursery from age of 3 to 5. But anything less than that is not necessarily school. Yeah. So anything below that, it should be crèche. So most times we want the children to be with you at home till they are 3, really. From 3 to 5, they can go away for 2 hours, play with the other children, play around, just learn to interact, social interaction. But by primary 5, I mean, by age 6, or some children want to start early 5, then that's when they really start school. So that is the definition of school age to a pediatrician. So that is our definition. I know that some people may not see it that way, but that is how pediatricians look at school. All right, optical eye drop. Optical, I'm not sure what is that. That's the trade name. Um, let's see what is inside. Um, anyway, so whenever you go to hospital and a doctor is seeing your child, please always ask them. Okay, the optical eye drop is an allergy eye drop. I'm just checking it online. Um, So it's supposed to be, well, I hope that's the same one you have, but it's okay. It's supposed to be like an anti-allergy eye kind of eye drop. So that's fine. So if you are using that already, there's really no need to give your baby loratadine as well. But one thing I want to just chip in with that is that whenever you go to hospital, don't just be interested in the drugs your doctor is going to give you. You need to really ask, what are you treating my child for? You have a right to know. A doctor must tell you what they are treating a child for. Oh, I think it's an allergy. Oh, I think it's an infection. Oh, I think it's malaria. They must always tell you that. And then so that the medication will make sense. All right. And sometimes the medication may not make sense because sometimes we actually not treating the disease itself, but we may be doing something else. Let me give you an example. If your child has diarrhea, and I'm saying I'm treating your child for diarrhea, and I'm giving you ORS or a zinc. ORS and oral zinc is actually not treating the diarrhea, but I'm actually trying to prevent the complications of the diarrhea. So I'm giving you the ORS to rehydrate the child. I'm giving you the oral zinc to cause healing of the intestinal wall and all that. But I'm not actually treating the diarrhea. The diarrhea itself is going to stop on its own. So the reason why it's important for you to understand that is that, so when I give you the ORS and the diarrhea does not stop, then you're not going to worry, because I already explained to you that the ORS is not going to treat the diarrhea. The ORS is not going to stop the diarrhea. The ORS is so that your child does not get dehydrated and have shock and have complications that come with that. So it is important for you to understand, have that conversation. So your consultation with your doctor is not just to get a prescription and drugs. It's just to understand what is wrong with my child. If you don't ask any question before you leave your doctor's office, you must ask at least 2 or 3 of those questions. What is wrong with my child? What drugs are you giving me? What is the drug meant to do? What are the side effects of the drugs that I should watch out for? When should I come back? Please always ask those questions before you leave, because it's very important that you understand what we are doing. And sometimes we don't explain, and your own expectation may be different from our own what we are trying to do actually. So it's best that we all ask that question. Ideally, we should tell you, but sometimes doctors are very busy, they are rushing through. But if you ask the question, then the doctors will explain to you. It is very, very important. For example, if your child is getting eye drops, you need to know, is it an antibiotic eye drop? Is it an allergy eye drop? What is it? What is causing the red eye? What is my doctor treating? It's so important to have that conversation. And then you need to know, how long should I do the treatment for? When should I come back if things are not better? It's very important to ask. I'm giving you those tips for next time. All right. Somebody said tips on potty training. So we have a whole article on potty training. So please go to site www.activepediatricians.com and read the potty training article. But just to say, children have to be ready first before you start potty training. Potty training, most children are ready around about 18 months. I know a lot of mothers will tell me, oh, I've started potty training my children at 5, 6 months old. That is not possible. It's not true, because there are certain things that need to happen before potty training. Number one, the child should be able to walk. So the child should be able to walk to a potty. So if you are the one putting the child on the potty, that is not potty training. Okay, the child should be able to walk, and the child should be able to take off their pants or diaper and be able to sit on the potty, do their business, and even sometimes be able to communicate to you. We poo, they must be able to do that. So if your child has not been able to do all that, the child is not yet ready for potty training, no matter what you think. So the child has to be ready before you start. So, and then you start putting them on the potty. Usually, sometimes to teach a new habit, you need to dedicate time to it. Meaning like 2-3 weeks just to do it. And what we normally recommend that you put the child on the potty every 2 hours, whether they feel like going or not. Let them just get used to that routine of sitting on it and all that. There are lots of videos, there are lots of things that children can watch that shows them how other children are sitting on the potty and all that. Some children like that, and you can show them. For the boys, you can show them there are things you can put in your WC, and then when they wee, it will change color or it will sink down. You can just use some of those as tips to kind of make it fun and interesting for them. There are songs that all these cartoon songs on potty training. There are lots of them, so those are things you can also use as well. With time, then the children will now be getting used to. They can link that when I need to poo or when I need to pee, I will sit on the potty. And of course, usually when they're starting, you still need to clean them up. But by the time they're about 3, 4, 5, then you can begin to do it independently. So those are the things you need to do. You can either use a normal potty, or you can use those ones that you can put on top of your WC in the house, that the children can climb on top of it, and like it will be on top of your own WC. There are different approach, but the most important thing is that the children must be ready. And some children are not ready until they are 2, some children are not ready until they are 3. And if you don't do it when they are ready, you will get frustrated, the child gets frustrated, and it becomes something of fear for them. So the most important thing is for the children to know when the children are ready, and then you dedicate time towards it. Of course, there'll still be accidents and all that, but over time they get it. Some children are very good, some children takes a little bit longer, but just be patient with them and then you'll get there. All right. Okay, I have another question. I think Adele may say my 11-month twin stopped taking breast milk and really eats aside cereals. That's not good. Your children need to eat. Your 11-month-old ideally should not stop breastfeeding. They should still be breastfeeding, but when you start complementary feeding, that's why I always want to emphasize going through the complementary feeding guide, go through the guide, because we need to understand the principles. If you don't understand the principles, we're going to run into all these problems. Complementary feeding is not a replacement for breastfeeding. Unfortunately, a lot of mothers, when we start giving them these cereals, we give them so much that the children don't even feel like they need to breastfeed. You must always be mindful of the quantity, the frequency of the complementary feeds. So when you start at 6 months, it's just twice a day, maybe about 25 meals. The rest of the food should still be breastfeeding. So if you are giving them too much and you're giving them through bottles and all that, then the children they will not just want breast milk alone, and then you're only giving them cereals, perhaps through bottle feeding, then they are not going to want to take any other thing else. So it's very important that we get the principles right. So if you're 11-month-old have stopped breastfeeding, they still need milk. So you need to give them normal age appropriate milk. Somebody was asking whether they can use the evaporated adult milk for a 6-month-old. Before I came online, no. If any child below 1 year cannot take the adult milk, you have to use the baby formula that is appropriate for their age. So anything for 6 to 12 months old will be okay for your 11-month-old. All right. And your children need to eat other food apart from cereals. Complementary feeding, again, is also not cereal feeding. A lot of us just want to give them pap or any of those cereals they sell in the stores. That is not it at all. There are all the food in your kitchen are what you can give to your children for complementary feeding, and you must always be adding all these different, you must always be trying new things all the time. So By the time they are 1 year, we want them to be eating whatever the family is eating. We want them to be eating from the household pots. That's the goal. So the goal is not for them to just be on cereal, 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 cereal. No, that is recipe for malnutrition, because cereal is mostly carbohydrates. There's no protein, there's no fat, there's no veggies, there's no fruits. All those things are not there. So it is important that we get it right. So Ada, I would recommend that you watch our all the videos on complementary feeding, but it's not all bad yet. You can still get them. It's so definitely they need their milk, so you need to get them in the appropriate formula since they are no longer breastfeeding. Two, you need to give them other food. So we already talked about that a little bit, and you have to be patient with it and keep offering it, and they get. And sometimes you will be surprised what the children like as you try new things. They may just, Lord, we love this. Maybe potato with butter, sweet potato butter, and maybe a little bit of your Titus fish. You just smash it together and give them with spoon. Please don't bottle feed them any food for complementary feeding. It has to be cup and spoon. And you'll be surprised that they love it. And just experiment with different things. The same food you eat, your children can eat it. And, you'll get there. All right. If you want more information, we have our podcast, we have our website, we have guide section, we have resources everywhere. I will recommend you go through them first. A lot of tips on those resources as well, and then you gradually start, and then hopefully they will get there. All right. Somebody say no, thank you, man. Okay. Somebody say, can adult or 21-year-old suffer tonsillitis? Anybody can have tonsillitis. Most time you feel it as if you're having sore throats. Okay, but it's mostly a childhood illness, but anybody can have it. If you see have your tonsils, you can have tonsillitis. All right. That's where can you get the guide. So if you go, because you're on Instagram, if you go to our Facebook group, once you go to our Facebook group, you will go to the guides. So it's one of the menu thing on the Facebook group. Or just go to our Facebook group and ask, I need a link to the guide session, and somebody will show you the picture of how to locate where the guide is. But it's on the menu. So if you will see all our various menu, photos, album, blah, blah, then you see guides, and then you can click on the guides. And we have several guides. We have guides on breastfeeding, we have guides on complementary feeding, we have on speech, milestones, we have on speech therapy, do it yourself for parents, we have on LD drinks, so many guides. So you can click on it and then you will see it is guide 2, the one on complementary feeding. You will see we have several videos there. We have articles there. We have a post that talk about different tips on complementary feeding. That is the first way to get it. Number 2, you can download Birth and Beyond app. I don't know whether I can write it, which is the app by the Global Health Media Video, and they have all those videos as well on this Birth and Beyond app. If you even scroll down our Facebook, our Instagram page, I'm sure you will see my review of the Birth and Beyond app. It's free on any of the Play stores, Google, iOS, and then you can download it and you can watch all those videos and follow the principles. Very easy to do. All right. I hope that's helpful. Okay. I think, okay. We've answered. Okay, I don't have any more questions. Oh, that's lovely. All right. Thank you so much for those who are joining us. We still have about 10-12 minutes before the end of the program. But while I'm waiting for your questions to drop, let me just quickly make my announcement to tell you about our. Okay, sorry. I'll tell you about our upcoming outreach to the schools. So we are going to the schools, all our secondary schools in Nigeria. Of course, we're not going to go to all the schools in one day, but hopefully over the next few years, we want to cover all the schools. And what is our goal is to go to each of these schools and talk to our students about first aid care. And we're going to give them a small booklet on first aid care tips. We want the students to know what to do. A lot of the time we see emergencies, medical emergencies happening in Nigeria, on the highway, in the schools, everywhere at home, and people are kind of lost. They don't even know what to do before they take the person to the hospital. So the idea is that we want to teach our students, and we want to also give them something they will have in their hand as a reminder tip, so they quickly go through it. So somebody's having nosebleeds, what do I do? You know how to pinch the nose. It's not going how that, it's actually this way. So those little things we want to teach them, and we want to give them those tips. I'm also going to leave some for the school, so that even the teachers, they have a reference guide. They can always quickly check it up and what to do. Somebody's having seizure, a convulsion, somebody's having an asthmatic attack. What do you do? Somebody is collapsing, they fainted. What do you do? Somebody is bleeding. Little things like that could really save lives. And so that is what we're doing this October. And we're going to go to all the schools in one of nearby you. We're going to all the states, all the schools, and we're going to share this material. So we really, really, really will appreciate you joining us and supporting us. And if you are an alumni group and you want us to visit your alma mater, please get in touch with us, and we can collaborate and go to your school, give them the EXO, give them the materials, and we really love to be part of that. So we have our account number, GTB, and both dollar, both naira, all is welcome. And also, if you are abroad, those of you overseas, you can go to our global giving page. So you can donate on our global giving page. This accepts any currency and all that. So you're welcome to support our projects. I believe together we will make Nigeria, make our students well informed about first aid tips, and hopefully that will lead to reduction of unnecessary deaths when there are medical emergencies. So we really, really, really appreciate you supporting us. All right, that's just my announcement. I don't think I have any more questions. Just to remind us that if you have any questions after I am no longer live, feel free to go to our Facebook group, Ask the Pediatricians Facebook group, and you can post your questions there from Mondays to Saturdays. We are there 24/7. We have our moderators, our volunteers, professionals, pediatricians who will be able to answer your questions. And we also have loads of resources on our on our Facebook group, on our website, that you can people will say, oh, something, I just come to the group, search what I want, I get the answer. Some people don't even need to ask, they just know how to get their answers, and it's been very, very helpful. That's why the first time mothers find it very helpful for them. So we are like your companion. You are your Omugo companion. So feel free to go to our Facebook group and ask your questions there. If you want to read about any of these topics, feel free to go to our website. And if you want to listen, there's also our podcast, which is available on most of the podcast platform, Google Podcasts, Amazon Music, Spotify, all of them. So just Google Ask Dr. Gbemi ATP, and you will get to our podcast, and you can listen as well. And you can obviously go to our YouTube channel and watch all these videos as well. So that is all the various platforms that we have to support you in raising your LD children. That's our mission, and that's our goal. Thank you so much. All right, I still don't have any question. Somebody say thank you so much, man. May God bless you abundantly for the good work you're doing. Thank you so much, Facebook user. I wish I can see your name. So those of us in the group, you need to allow what's the name? StreamYard to allow your name to show, but it's okay, it's fine as long if you don't want your name to show, but it's okay as well. But thank you so much. All right, I still don't have any questions, so I'll be rounding off in about 5 minutes. So if you still have your question, feel free to post them before we close for the day. Thank you so much. And remember that all these videos, we don't delete them. They're always available on whichever platform you're watching right now, Instagram, Facebook. The videos are always going to be there. So if you are just coming in and you're late, not to worry, you can actually watch the video again. And sometimes you may just be lucky somebody has asked the question that you have in mind. So feel free to just listen in. And if you still have questions after watching the video or listening to the video, feel free to post your questions directly on our Facebook group, and we will try and answer them as much as possible. We try to answer your question in 24 hours, but sometimes it takes us up to 48 hours because, like we said, we try to make sure that your answers have professional evidence-based answers. So sometimes we may need the right professional to be the one to answer that question, and until they come online during their free time, so it may take a little bit of a few hours sometimes to get your question answered. And remember that if you have any emergencies, please don't post emergencies to the group. For emergencies, you have to take the children to the hospital so that we can see them physically. But if you have question about education, any question about what do I do? Should I do this? Do I feed my child this way? Is this right? Is this wrong? Those kind of questions, we are happy to answer them. But if a child is very sick, a child is convulsing, a child is losing blood, very ill children, please take those ones to the hospital and we will see you in the hospital instead. But if it's something that can wait, that is fine to post on our Facebook group. All right. So thank you so much for those of you who have joined us. Remember, if you still have any questions, feel free to post them now. I have 4 more minutes with you. Well, if you don't want to post them online, you can post them on our Facebook group after this session. Remember, on our Facebook group, you can post your questions without your name. So we have room for you to be anonymous. So nobody's going to know, because there's a time we have a lot of people, when they post questions, then all their family members will come after them and harass them and, bullying them, which is quite sad. But luckily, we're able to get Facebook. We were the one that actually pressured Facebook to start the anonymous posting option. We were like, we really need it because we want people to be able to ask health questions without the neighbor knowing who is asking this question. So they have some level of confidentiality and anonymous option. So, and that's how Facebook got to start the anonymous posting, and it's really, really nice. So you can ask a question and nobody will know it's you. So, which is why we like to answer questions on Facebook instead of Instagram. Instagram is too restricted for what we do. So sorry to the Instagram people, but if you have questions, you have to put it on our Facebook group, and then that's it. All right, tell your star. My baby takes both breast milk and formula. How old is your baby? 10 days old. Okay. It is hard to stop the formula. It is hard to stop. It is the easiest thing in the world to stop. You just stop. You just stop the formula. You are the one that has the formula. You are the one that has the baby. Just throw away the bottle, throw away the formula. End of story. The formula is stopped. Give your baby the breast milk only. It's not difficult to stop formula. You need to understand that your baby only knows what you give to the baby, all right? And your baby crying is not always because of hunger, because I know most mothers, that's why you do formula, because you say, oh, maybe baby's not getting enough breast milk, baby's crying and all that. No, the baby is not crying, and so only because of hunger. Baby is crying for many reasons. That's the only language baby speak. Okay, so the baby sucking for hours is not from hunger. Okay, baby suck for everything. So you need to know when your baby are sick. If you feel your baby, your breast is empty, the baby's had enough milk. The baby doesn't have to be sucking all the time. Most baby will suck for only 10-20 minutes to get all the breast milk they want. So you take the baby off the breast, put the baby on your shoulder, have other way of comforting your baby. It's not everything about putting the baby to the breast. Okay. Number two, make sure your baby is well attached to the breast, which is the number one reason some mothers also struggle with breastfeeding, because your baby is sucking because baby is actually not getting breast milk. So you need to make sure that the baby is well attached to the breast. When your baby wants to feed, make sure the mouth is open wide and you push in not just your nipple, but the nipple and the areola. The areola is the black part beyond your nipple. You must not be seeing that areola when your baby is breastfeeding. If you are seeing your areola, that means your baby is not sucking properly. You have to make sure your breast is the most of the areola is in the mouth of the baby, because that is where they make banks, the sinuses, that is where they are. So when your baby puts its mouth on the sinus, on the areola, the milk just gushes out into the mouth, and the baby will suck, and the baby will stop sucking when they are full, and baby will sleep for 3 hours. So, but if your baby is sucking on the nipple, no milk is coming out, baby is frustrated, you are frustrated, everybody is not going to be happy. So the most important thing is to get breastfeeding right. Attachment of the baby to the breast is 98% of the breastfeeding. If you don't get the attachment right, you are going to have difficulty with breastfeeding. Breastfeeding is the easiest thing in the world to do, and you can produce enough milk for your 10 days old baby. Your 10-year-old baby does not need any formula. Lastly, also start putting your baby to the formula, you are going to create what we call nipple confusion. Okay, your baby now wants to take formula and does not want to take breast milk anymore, and that is going to be even more dangerous. So we don't want you to give your baby bottle, we don't want you to be giving them formula at 10 days old, because then the baby is going to get used to the formula and the bottle, and the baby does not want to breast milk. That is what we call nipple confusion. So please put your baby to the breast. If you want to watch breastfeeding videos, the same Birth and Beyond app link, you can watch. There are breastfeeding videos there. If you go to our Facebook group, there are breastfeeding videos there. Watch it. You will love it. And breastfeeding is the best for your baby, of course. So you know that is why. So your baby is not feeding for hours because baby doesn't need to feed for hours. So your baby is feeding for hours, something is wrong. And I've told you all the possibility that could be happening. So you just need to make sure you sort it out. And your baby is still young, so you can sort it out now and get it right, and you'll be okay. You don't have to put the babies to the breast every time baby cries, okay? There are other ways to console your baby, pacify your baby without always using the breast, okay? So that's what you need to get right. All right. I hope that's helpful. Um, Somebody said I post a question anonymously on Facebook. It wasn't answered. I didn't know. It depends on many things. When did you post this question? If you just post your question today, we will see answer it. Please allow up to 72 hours before you say your question has not been answered. The question may be waiting for us to answer. We approve every question that is put to us, except your question is breaking a rule. What are the rules? If you post pictures of genitals, I've declined to post today. Somebody was posting a picture showing the penis of the baby and all that. Another post was posting picture showing the anus. We don't approve those kind of questions. Facebook does not want you to post naked pictures of children. It is counted as child pornography. I know that is not what you are meaning to do, but that is how it is on social media. So don't post a question that require you attaching a picture of a naked child showing their genitals. We are not going to approve that. Okay. If you post a picture and you put pictures of advert things, you are putting pictures of cereals or a particular brand of anything, we are not going to approve that. Ask your question without those pictures. So usually when we decline your post, we always give you the reason for the declining of that post, and some of those declining are done by admin assist. It's automatic, so we've already put in some criteria for Facebook. If this is there, don't approve it. So but you should get the feedback. Most of the time you should get a feedback on why your post was not approved. If you are new to Facebook, less than a month, sometimes your post will not be approved, because we notice that those who are scammers and spammers, they tend to create new accounts all the time. So we usually want people who have been on Facebook for 1 month to ask questions. If your picture, if you have a Facebook profile that doesn't have a picture, your post will not be approved, because most scammers also don't put profile pictures. So if you are falling into those categories, that will be the reason. But then you should get an answer from the Facebook admin assist that is declining your post, or from us. We will always tell you why. Most of us don't read the feedback. We just see, oh, your post has been declined. You have to click on that, and so you can see why the post was declined, and we'll give you answer. We were having some Facebook bug over a few months ago, not months, weeks ago, where some Facebook we just not allow those posts to be approved. We don't know why. That is a Facebook problem. And usually we try, but sometimes we screenshot your question and answer it. We always tell you Facebook is the one not allowing us to approve your post. So sometimes we have no control over that one. It's a Facebook bug, but I think it seems to be over now. So feel free to post your question again, and we will see if we can answer them. Last question. Um, Help me on a tip to cure my baby Ella. Okay, you have to see a dermatologist or a pediatrician. We cannot treat something we have not seen. Ella is a word used by Yorubas to cover almost any kind of skin rashes in babies. They are not all the same, and I usually don't want mothers making their own diagnosis. I would rather you go see a professional to deal with it and to tell you what is wrong and what to do about it. So don't just go and be using anything on your baby's skin. Neighbors recommend this recommend that. Even on Facebook, when I'm trying to answer some of this question, I see mothers jumping in and telling fellow mothers, go and do this, go to Elewe Omo, or ask the pediatricians. Mothers don't just know their boundaries. And of course, that will be the last comment they will make on our Facebook group. They are gone, because we're going to block you if you put that kind of comment in our group. So don't do neighbors treatment. Don't just keep, because you're going to, sometimes dermatologists will tell me some others have even damaged the skin. Then we're not even dealing with the original problem, we're dealing with the consequences of the wrong treatment. So please don't do it. What we normally recommend is do the normal thing first. Use natural products, things that don't have chemicals. Use what we call hypoallergenic. So things that are natural, your black soap without perfume, your ori, your shea butter, your coconut oil, olive oil, Vaseline Blue Seal. Use those normal things on baby skin. No powder, no perfume, no cologne, all those things that can make your baby to have allergic reaction. Just don't use any of those ones. All those nice baby packs, smelling nice products, most of them are not good. You avoid them. So do the right things first. If you are doing the right things and your baby is still having the skin rashes, that is where you need the professionals to now tell you what kind of a rash. Is it allergic? Is it infection? Whatever. And then we will tell you the treatment. And some skin conditions are not curable. We manage them. So like a mom was asking me over the weekend, child has atopic dermatitis. If your child has atopic dermatitis, you're going to be a friend of your dermatologist for a long time, because there is no cure, but we manage each flare, each episode. And sometimes knowing that and accepting that is the beginning of the management, because most parents will jump from one doctor to another doctor because you are looking for something that is not lost. You're looking for the cure where there is none, and there's really no point, which is what I was trying to explain. You have to understand this is the condition my baby has. It's not going to disappear completely ever and never happen again, because that's what most parents want me to tell them. Give me the treatment that once I give it, it will never happen again. Sometimes for some conditions, there's nothing like that. That is the honest truth. And sometimes we are honest with you, but sometimes I find that parents don't like people that are honest and tell them that. They look for somebody that will tell them lies and tell them, I have something that will clear everything. But we all know that it's going to be a lie, because then when that doesn't work, they will waste money and go to another person. So you need to understand that first, which is why I would recommend you see either a pediatrician or a dermatologist, so that we can have this kind of conversation. We can talk about what you can do to make it better, even if it's not going to go away completely for a while. So also understand that. But the good news is that most of the time as the children grow older, they tend to outgrow some of these skin issues. But at least there are things you can do to make it better. But sometimes we may not necessarily have a cure. And I think that's the most important information that we always give to parents. So I think that is it. All right, final one. My time is up and I have to go. Please, my baby will be 8 months in 10 days. I'm concerned about the weight. Birth weight is 2.7. Current weight is about 7 kilos. The weight is not bad. It could be better. Should be around closer to 8.5. But 7 is not so bad. Just keep feeding your baby appropriately, complementary feeding, variety of feeds, and just keep monitoring the weights. It's not too worrisome now, but we can do. We can make sure the baby is eating better. And I hope you're still breastfeeding and giving complementary feeds. If you have more information on complementary feed, go to our Facebook group, watch all those our complementary feeding videos, and then you'll be fine to go. All right. Okay, thank you so much, everyone, for joining me this evening. If you still have questions, feel free to go to our Facebook group and you can post your questions there and we'll try and answer them. Like I said, just be patient with us. Sometimes give us up to 48, 72 hours before you start saying with no answer, we will answer them. But like I said, if it's emergency, please go to the hospital. Have a wonderful, wonderful evening. And remember to support us. Please, please support Ask the Pediatricians Foundation and be our partner in progress. So I'll come your way again, hopefully next week. Till then, have a wonderful evening. And it's bye from me.